This is my continuing video series on the current health care bill that has just been passed in Congress. We're on video number 8. And believe me, there's going to be a lot of videos on this. You have no idea how big this bill is, really. Anyway, on the last time we were on this video, we were on page 15, and we were talking about what had to be in your package. You know, when these health care providers, they offer you a package to enroll into. They have this enrollment period, and they give you this little package to review to decide whether you want that particular insurance or not. Well, we established in the last video that presentation they give to you has to be no more than 4 pages long, and it has to be in a 12-point font. Okay? Now, in this particular video, we're going to talk about some of the contents that have to be in this 4-page presentation that they give to you. Okay. Now, there are insurance and medical terms. And these insurance and medical terms have to be uniform. What that means is that if you have 2 health insurance plans that are trying to get you to enroll in them, each one of them has to explain things the exact same way. In other words, if they have a particular insurance term in one health care package, then they have to use that same insurance term in the other health care package. Okay? And let me try to say that one more time. You have 2 companies like, let's say, Prudential is one of them, and Blue Cross and Blue Shield is the other. Okay, and both of them are trying to present you with a health care package that they would like for you to enroll into. Okay, whatever insurance terms that Prudential uses to describe their health care benefits, well, Blue Cross and Blue Shield also has to use those same terms. And the Secretary of the Department of Health and Human Services is going to dictate what those terms are. And the reason why they're doing this is because it's really hard to compare 2 health insurance plans when they're worded differently. So the Secretary of Health and Human Services is going to step in and say, okay, all of you guys have to use the exact same terminology. That way, when the potential enrollee reviews your plans, then they're not going to get confused. And that not only applies to insurance terms that they're going to be using, but also medical terms. So if one insurance plan uses the term cardiovascular disease, then the other healthcare provider has to use this term cardiovascular disease. They can't use something else. That way you don't get confused anymore. All right. And then they go on to cost sharing description. And in order to find out what they're talking about in cost sharing description, you have to go to section 1302B of the health insurance bill. Okay, this current legislation that just got passed in Congress. So where is section 1302B? Well, it's on page 45. I found it. And the following things have to be included in the cost-sharing description of your health insurance package. All insurance providers now have to offer you ambulatory patient services. That means that you can call an ambulance at any time, and the insurance has to pay for it now. Okay? Emergency services. All health insurance plans have to pay for your emergency room visit. The end. If you're stuck in the hospital, all health insurance plans have to pay for hospitalization. Maternity and newborn care. All health insurance plans have to pay for this. Mental health and substance abuse disorder services. All health insurance plans have to pay for this. They all have to have a prescription drug program. They all have to have this wellness services and preventive services and chronic disease management program. All of them have to have it now. And all of them have to offer pediatric services, including oral and vision care. So in other words, when you have your little kid, as your kid's starting to grow up and they're dependent under your coverage, then the health insurance plan has to cover them pediatrically all the way until they're 26 years old. And they have to, that includes vision and dental care and the whole 9 yards for your dependent kid. Alright, now I know that's a mouthful, and I'm going to stop right here, and I will continue on with this in my next video because there's a lot more to cover. I'll tell you more in a future video, so stay tuned.